Good afternoon. I'm Joe Ruffolo, President and Chief Executive Officer of Niagara Falls Memorial Medical Center. And I'm here to give you a weekly update on a number of programs and services that's currently going on. But first and foremost, I would like to comment on our Sholkoff Nursing Facility. So the New York State Department of Health has put together a number, dozens of COVID testing teams. And they go into nursing homes to test all of the residents and all of the employees of the nursing homes across New York State, which is probably a very good thing. And they visited the Sholkoff Nursing Home facility on Saturday, conducted all of the COVID testing on residents and our healthcare workers. And on Monday, we received the results, and surprisingly, we had 19 residents that tested positive for COVID out of the 95 residents that we have. What's interesting is that overall, all of those positive residents that tested positive were asymptomatic. They really did not have any fever. Their intake was well. So it was a real surprise to us. But so now it gives us a baseline. We've developed a COVID unit within the Sholkoff Nursing Home. And they'll be closely monitored there and overall doing well. And once they are no longer active positive, they will return to a non-COVID wing within our nursing facility. In addition, on Monday, we had an unannounced survey by the New York State Department of Health Infection Prevention Team. So there were 5 of them that came in on Monday. And at the end of the day, the verbal exit conference was we were in substantial compliance with all infection protocols, policies, and procedures with respect to COVID and employees, healthcare workers, and residents. And in addition, they commented that they were fairly impressed with some of the things that we were doing over and above. So the point is, as a reminder, the Sholkoff Nursing Facility is a 5-star Medicare CMS ranked facility. There is no higher ranking in the United States of America than 5 stars. And in addition, New York State has the Sholkoff Nursing Facility within the top 10 percentile in the state in terms of the highest quality performing nursing home residents. And from a personal level, I will tell you, if I would not put my mother and father there, I wouldn't expect you to put your loved ones there either. And both my mother and father were cared for there like a family member, and that's how that staff cares for each of your loved ones as if it was one of their family. They're a very proud staff, and they provide excellent, compassionate, dedicated care around the clock. In addition, they have beautiful grounds, the Sholkoff Park, which was recently groomed, and the residents get to enjoy the outdoors around the fountain, the paths, and the park benches to give them nice fresh air and feel that sunshine. We also have an excellent subacute facility within the Sholkoff. They have 15 beds. Rehab is done twice daily for the most part. And for those that are receiving end-of-life care, we have David's Path, which is a hospice unit that's in joint venture with Niagara Hospice and providing high-quality, dedicated, compassionate care for end-of-life. So it's a very comprehensive center. It's very safe, and we're very, very proud of our Sholkoff Healthcare facility. The second area I want to cover is the emergency room. So pre-COVID, before COVID, we were averaging between 85 and 90 patients per day. And since COVID, and recently, we're probably averaging around 50 to 55 patients a day. But what you need to know is that on any given day, roughly one, maybe two patients come in that are COVID symptomatic or even positive COVID. So over 95% of the people that come into ER1 are non-COVID, non-symptomatic patients. Very safe. We have 2 dedicated rooms for COVID patients. They're at the far end of a wing, isolated within an area. So over 90+% of the capacity within ER1 is non-COVID related. And as I said, over 95% of the patients that come here are not even COVID symptomatic. So it's very safe. Don't delay treatment, because some of the cases that we actually see come in because they're putting off surgery or they're prolonging the pain that they have in their abdomen, we are seeing some very, very complex cases that should have been easily handled if they didn't delay treatment. So please don't delay treatment. Go to ER1 if, in fact, you have urgent situations. The third area is labor and delivery. And knock on wood, we have not had one COVID mother or baby in that unit since COVID started. So it's basically been COVID-free for the most part. So it's a very safe, clean environment. Lots of precaution and policies and procedures are within that unit, that lockdown unit. We have 5 excellent OB/GYN physicians to serve you under the leadership of our chief, Dr. Donna Feldman. The fourth area is our elective surgery program. So as I had shared with you, our elective surgery program began on April 28th. And I'm very pleased to say that we are bursting at the seams with elective surgeries. So, as you know, people have to be tested 72 hours prior to surgery. But of those that have been tested, so we have tested, and think of it as a random sample, because these are people that are coming from all over, not just Niagara County, but also Erie County. For pre-op testing, we've tested over 373 individuals. Only 2 were positive. 371 of the 373 that came for surgery were tested negative. And overall, of all of our testing, which includes community testing, roughly only 10% of all of the people that we've tested are testing positive as of the recent data. But in terms of elective surgery, minimally invasive, robotic general surgery, orthopedic surgery, neurospine, gynecology and urology, vascular, bariatrics are all very busy. So that's telling you that it is very safe to have your surgery. So don't prolong surgery. If you are scheduled for surgery, go and have it done. It's a very, very safe environment. In addition, we have developed accommodation for visitors across the street from the hospital. We have a dedicated area where visitors can stay and wait for their loved ones and be in communication with the OR and with the doctor once the patient departs from the operating room. The fifth area is wound care. Our wound care center, which also has 3 hyperbaric chambers, is in partnership with Restrix. We are in the top 10% in terms of clinical outcomes in the United States of America in our wound center. It's the only multidisciplinary wound center around in Western New York. We have infectious disease, we have general surgery, we have podiatry, we have vascular surgery, all under one roof, providing wound treatment services and hyperbaric medicine. And it's a very busy unit. Volume is exceeding where we were before COVID. So those wounds that aren't healing, again, Don't delay. We have seen people have to have amputations because they're delaying their wound care, especially those with diabetes. Don't delay wound treatment. If you need an appointment, call our wound treatment center. And coming soon, the Golisano Medical Oncology Center is currently at the tail end of its construction. It's a medical oncology center that is in partnership with the Roswell Park Comprehensive Cancer Center. It's scheduled to open sometime mid-summer. Hopefully it's mid-July. Its services will be provided by the best and the brightest Roswell Park clinicians, led by its medical director, Dr. Ram Kumar. We'll be providing medical oncology, hematology, immunology, and chemotherapy services, and also consultation for all types of cancer by Dr. Ram Kumar and the other clinicians that will be there. We anticipate that over 2,000 new patients will be coming on our campus, providing that are going to be needing cancer care on an annual basis because of the high cancer rates within the region. And we anticipate, because of the easy access now for Niagara County residents, not having to travel over the bridges, early prevention, detection, we hope to really bring down the cancer rates within this area by providing these services locally in our community in concert with some of the national and renowned specialists within Roswell Park. That project is, construction cost is over $2 million. We have over $500,000 to raise. And the good news is we have a number of naming opportunities that are available. And what a perfect way to leave a legacy for yourself or a loved one to have a naming opportunity be presented and long-lasting within that cancer center. So if you are interested, or if you have a family member or a friend that are interested in a naming opportunity, please contact our Niagara Falls Memorial Medical Center Foundation office. And they would be happy to provide you with a tour and present to you those naming opportunities that are currently available. And they're going to go fast, so don't delay. So the last thing is, in closing, there's still fear out there, right? And I get it. There's still fear out there. But I'm telling you, it is very, very safe to come back to the hospital. Don't delay your appointments with your primary care physician. Make those appointments today. Don't delay the preventative testing that you need on a periodic basis. Don't delay those tests. Those tests are very, very important to be done on a timely basis. Have those scheduled with your primary care physician. Don't put off your surgery. We've shared with you cases that have come into the emergency room, and the result is that the risk is substantially higher as compared to the period in which they should have had their surgery done. And last, if you need emergent care, as I said, roughly 95% plus of the patients that come into ER1 are not COVID related. A very safe environment. Don't delay emergent care. Come to ER1. So thank you for tuning in, and stay healthy.